Hello, welcome back to week 4 of the School of Social Work vlog series. My name is Amie Martin, and this week I want to share with you some statistics about perinatal mood and anxiety disorders. My field placement had put together a workshop that she shares with medical community about perinatal mood and anxiety disorders, and I also had the opportunity to participate in the March of Dimes Maternal Mental Health Day Advocacy webinar. Perinatal mood and anxiety disorders occur during pregnancy and the first year of postpartum. For breastfeeding mothers, their hormones may continue to shift during breastfeeding and during rapid weaning. About 1 in 7 experience serious anxiety or depression during postpartum, and about 1 to 2 of 1,000 will have postpartum psychosis. Suicide is one of the 3 leading causes of maternal death. During the COVID crisis, places like Postpartum Support International has seen an increase in call volume by over 300%. Postpartum Support International is an international agency that provides resources and support groups for women, dads, families that are experiencing perinatal mood and anxiety disorders. We do have an Alabama chapter that I serve on the board for, and we offer warm line calls and resources to moms in Alabama. The March of Dimes, they are planning their Maternal Mental Health Advocacy Day in March. During their webinar, they shared some important screening and treatment information. One of the questions that they posed was why treat maternal mental health, and they said that untreated maternal mental health has an impact on the mom and baby. This is definitely something that I have seen in child welfare in cases where maternal mental health wasn't caught in time or they didn't treat it. And actually one of the reasons that I wanted to come back to the University of Alabama to get my master's degree was to provide more preventative services for maternal mental health. And so why this information is so important to me, and I'm so passionate about it. When a woman has untreated mental health issues, she may have trouble managing her own health and nutrition as well as her baby's. There may be increased substance use. Without education or alternatives for medications, many women fear taking medications, and not treating their symptoms can have bad outcomes. Moms are less responsive to babies' cues. There are higher rates of preterm labor. Babies may have excessive crying. And then there's definitely impaired parent-child interaction. Again, another topic that I'm super passionate about. I also offer parent-child music and movement classes because I feel that it's really important for kids and parents to focus on that positive interaction and bonding. And that's one of the things with untreated maternal mental health, that they are seeing a lot of impaired parent-child interaction. So the cost to society, it affects wages and productivity, affects partners and other children in the home when maternal mental health issues are left untreated. Working moms may have some special circumstances that returning to work may come as a relief, but also there may be some increased anxiety for others. There's social issues, structural issues, and this is more likely to affect women of color and single mothers. A path to wellness. So as I talked about last week about self-care, path to wellness really needs to focus on self-care. Some of the information they provided was needing blocks of sleep, and that's definitely something my field placement that she talks about with her clients is just really trying to accomplish blocks of sleep versus an hour or 2 hours. And then needing to address maternal mental health from a prevention standpoint. This really spoke to me because I feel very passionate about that. And then helping moms be able to ask for help and not have a fear of asking for help from their provider, fear of what might happen or the outcomes. important for the mom to delegate tasks, let go of perfection, get some social support. And if those don't work, look at talk therapy, medication, or hospitalization. At my internship, again, she focuses a lot on self-care and accessing social support. In our mental health coursework in adult mental health, we talked a lot about medications and when those medications are indicated and what they're for and the different types of medications. In my placement, I've learned that Zoloft is one of the first medications that doctors tend to prescribe that's very effective for moms experiencing postpartum anxiety and depression. As I stated, this topic is very near and dear to my heart. My past work in child welfare and then wanting to do something more preventative to help moms and dads or families through that difficult time, and then having my own issues later in life, experiencing something that I was like, wait, I'm a social worker, I should know what all this looks like, but it looked different and it felt different. And so again, it just made me more passionate about maternal mental health. And so I wanted to thank you for the opportunity to share that information.